My name is Nadine Tung, and I'm a medical oncologist from Beth Israel Deaconess Medical Center. And I, too, want to thank Evelyn and Peg and Cliff because the BCRF is really fundamental. It's essential for the research that we do, so thank you so much. The research that I do in collaboration with Dr. Stuart Schnitt, who's sitting here in the second row, and fortunately for me, he's one of the leading breast pathologists in the country. And our interest is in those breast cancers that develop in women who are born with one of these BRCA1 or BRCA2 gene mutations, women that are born with an abnormal gene they've inherited from their mother or father. And those are the cancers that we've been interested in studying. I think it's important to say right from the start that even though those breast cancers may only comprise 5 or 10% of all the breast cancers in total, what we know now is there's at least 15% of the general breast cancers in the general population, women who have not inherited these genes, that act like these BRCA1 and 2 breast cancers. So I think it's important to highlight that whatever we learn from these cancers is going to be applicable to a larger number of women with breast cancer. So some of the things that we're involved with, there are some very new, novel, and exciting therapies that are really geared for this particular kind of breast cancer in these BRCA1 and 2 women, and for that perhaps the other 15%. New treatments like PARP inhibitors, you may have heard these words, or old chemotherapy agents that are used for other cancers and are usually not used for breast cancer, that we're finding are exquisitely effective and sensitive in these kind of cancers. And certainly many of us are involved in clinical trials looking at these. So as an introduction and sort of a background, what we have been doing, and in collaboration with Judy Garber, who is one of the scientific advisors at BCRF, is that Stu and Judy and I, we've been collecting about 200 of these cancers from women who have these BRCA mutations, and we've been analyzing them and looking at them in different ways. And so with the theme of every cancer is different, what are we trying to do? We're trying to identify a very specific or unique profile in these cancers that we can then apply to general breast cancers to recognize or identify those in the general population that might act like the BRCA1 and 2 breast cancers, so that they might be exquisitely sensitive to these novel and exciting therapies as well. So that's one approach that we're taking. Every breast cancer is different. What is different about these breast cancers? Well, one thing that we know is that every cell has mechanisms to repair itself when it gets damaged, and our cells are getting damaged all the time from radiation and aging. And these BRCA cancers and perhaps these other 15% they are not able, one of the pathways is defective and they can't use it. So that's why the therapies are specifically effective in these cancers, because they take advantage of that knowledge. And so we're looking at a lot of the different other pathways that these cancers can use to repair themselves, to see if they're working, if they're not, to give clues about how we might be able to treat these cancers. And finally, I'll highlight one more thing about how cancers are different and what we're doing with all of these BRCA cancers. Many of you may know that breast cancers can go in different directions. Some are very sensitive and responsive to hormones, and some are not responsive. They're estrogen receptor negative. They don't grow in response to hormones. So one of the questions we've really been looking at is how this BRCA1 gene, this defect, really influences whether a cancer develops into the kind that is sensitive to hormones or the kind that is not sensitive to hormones. And so this whole relationship is important, and we think that we're going to learn a lot from that and be able to apply it to other cancers, because we think the BRCA1 gene is very important in that. And I also want to mention that Andrea Richardson from the Brigham and Women's Hospital, this is an excellent story of what BCRF allows you to do that other funding sources may not. We started to look at this relationship between the BRCA1 protein and the estrogen sensitivity or lack of it in one way. And Andrea Richardson heard us speaking at a talk and came over and said, I think I can look at that in a better molecular, sophisticated way, and we went in that direction. So I think that kind of flexibility and collaboration among all the people that work in BCRF is really very unique.